Well, hello, ladies and gentlemen. Hope you are all having a fantastic day. My name is Michael. I will be your moderator today for our webinar and wanted to take a moment and thank you very much for joining us here today. And really looking forward to having an opportunity to kind of share with you all good things about refractive lens exchange and your vision and be able to answer any questions that you've got going on with your eyes. Dr. Cutarelli, how are you today, sir?
Hey, you're doing well, Michael. How are you?
Great. What's the latest and greatest on your end? Things going good?
Yeah, all good. We're
Excellent.
ready to talk about RLE whenever we get it going.
Yeah, well, let's get after it. So, ladies and gentlemen, a couple of things on the housekeeping side that I'm going to recommend for you. We're going to go through some of the most common questions people have about refractive lens exchange. I'll put those up on the screen in a few moments. But then what I would like to do is encourage you to ask any and all questions that you have about the actual procedure itself, or about your vision in general. And the way you do that is you click on the word that says more, and then there's a little Q&A that's right there. You can be able to select that and ask your question. Number two is I want to set the frame in your mind is what is a really good outcome at the end of our time here together. That's not to decide to have surgery. Really, the next step for you is to find out if you are a candidate, and that involves coming into our practice. You can also do a virtual consult, but most people after this webinar, they find that coming into our practice is appropriate. It's a free examination, and we can kind of go through all the different things that you know make sure you're what's going on with your vision and kind of take it from there. So. What I'm going to do is I'm going to pull up our slides here and then we're going to get right after it. So just bear with me here. There we go. Awesome. Okay. So, welcome again. And why are you here? Well, many people are here because they're frustrated wearing their reading glasses. They're frustrated wearing readers, like I said, distance glasses, contact lenses. Maybe they want to work out or golf or pick up their kids or grandkids, whatever it is, without having to rely on them. Whatever your reason is, that's what many people have found is especially at past the age of 40 that their vision kind of gets a little bit worse. And so we're going to explain all of that today for you. Obviously, if you've got choices for your vision care, we'd be honored for you to choose our practice. But I'd recommend if you haven't heard about much about our practice, go on to the different social channels and you'll be able to kind of get a flavor for the experience that other people have gone through. Dr. Cutarelli, obviously your credentials are on the screen, but I'd love to give you an opportunity to talk a little bit about our practice, why you're so passionate about vision, and just anything you'd like to share about the approach you take for patient care, please.
Yeah, I'm Cutarelli Vision. Was a practice I founded in Denver and Fort Collins in 2008, and we expanded to Colorado Springs and Boulder Valley in 2019. I've been in Colorado since 2000, and I've been fellowship trained and board certified, and really focused on with the practice emphasis on vision correction, laser vision correction, and lens vision correction. And I've that's been my area. I've done the most of these types of procedures in Colorado, over 90,000 of them. And I've really tried to pride myself on getting the best training, which means, corneal specialty and refractive surgery specialty, in this area, and then pride myself on having the full range of refractive surgery techniques. That means LASIK, laser, other types of laser, and different types of lens implants. So, we have all ranges. We have the most lasers for this type of practice, and we have the full range of lens options because that's really our focus is to get you out of glasses.
Yeah, so let's start actually with some of the questions. And ladies and gentlemen, I'm going to show you the questions, then we're going to take the slides down so we can have just a conversation, and you can be able to see Dr. Cutarelli in a larger video, if you will. We'll talk about what is refractive lens exchange. We're going to start out actually talking about why your vision is changing right now. We'll talk about where cataract surgery fits in or not. What about those people that have had LASIK in the past? Does it hurt? Is it safe? Recovery time, limitations on activities, does it treat astigmatism? Kind of see them all there. We'll talk about lens options, side effects, pricing, and all that kind of good stuff. Dr. Cutarelli, I'd like to kind of begin with the sort of like the discussion of what is happening to someone's eye, as especially after the age of 40, and why refractive lens exchange is becoming the go-to procedure for those people that at a certain age. What are your thoughts on that, please?
Yeah. Well, around the age of 50, but even in the mid 40s, people start to notice that they're losing their ability to see up close, losing their reading vision. And that's because in the 40s, the lens, in your late 40s, the lens of the eye starts to lose elasticity. It gets stiffer, and the muscles that control its ability to focus up close get weaker. And so, excuse me. So, people see that their vision begins to decline. And so um, that's where refractive lens exchange comes in. Often we can do LASIK to a large extent, but LASIK won't accomplish the restoration of reading vision and achieve things that refractive lens exchange would accomplish. Hmm?
And I'm going to just launch a quick poll to kind of get a feel for
Uh,
the age of everyone that is here. If you want to take just 2 seconds and just kind of tap your answer and where your age is at, that'd be very, very helpful. Let's talk about the actual procedure. What is refractive lens exchange? Many people may have never even heard of it. Kind of, how do you describe it to somebody, please?
I'm sorry, Michael, you cut out there.
Oh, I'm sorry. How would you describe refractive lens exchange to somebody? What the procedure is, please?
Yes, refractive lens exchange is a 7 or 8 minute procedure, 7 or 8 minutes per eye procedure which is painless, in which we remove the lens that's the lens in the eye that's becoming stiffer and muscles weaker, and we replace it with a permanent lens, an acrylic lens that will give you good distance vision, and good up close vision, and everything in between, so-called intermediate or mid vision. So refractive lens exchange, we tend to do both eyes at the same time. It's a procedure that improves distance, near, and everything in between, as I said, but it improves nearsightedness, farsightedness, and astigmatism. It's permanent. Refractive lens exchange gives you good near vision and good distance vision, but it also stops the decline, that steady decline of reading vision that comes with age. So it's really attractive to people because it could be their last vision. It's a lasting, permanent vision correction procedure, and it's usually their last vision procedure.
Yeah, and I'm going to launch just another quick poll. The question is, have you had LASIK before? So if you wouldn't mind, ladies and gentlemen, just kind of tap in there and just let us know if you've had the procedure. Let's tackle that question though, while people are responding, Dr. Cutarelli. Can
Mhm.
they have RLE if they've had LASIK in the past? What are your thoughts there?
Yeah, people who've had LASIK in the past, PRK, um, and RK, radial keratotomy, they're all excellent candidates usually for refractive lens exchange. So yeah, shouldn't deter anyone at all. Mhm.
Yeah, and 40% of the people that are here have actually had the procedure, so it's quite helpful. Let's take the other end of the spectrum.
Yeah.
Where does cataract surgery fit in or not? So, like, what is if I have RLE?
Well,
You know,
refractive lens exchange does prevent the need for future cataract surgery. So most people, are concerned, well, what happens after refractive lens exchange? Will my vision continue to decline? No, the thing that was declining with age is the lens of the eye, and that's been, exchanged with an ideal lens for you, an ideal lens that's measured and customized for you. Furthermore, that procedure does prevent the need for future cataract surgery. So there's a lot of benefits to this procedure. It kind of does everything. And that's why it's become so much more popular in the last 5 years. I've been doing it for 15 years, but the technique has been there and the technology has been good, but the technology has gotten great in the last 5 years.
now, let's talk about the actual procedure itself from a patient's perspective. They
Mhm.
find out that they're a good candidate, then they're there on the bed, if you will. We've decided to move forward. Does it hurt, and how safe is this procedure? Just what is someone going to experience on the day of place?
Yeah, well, the procedure, as I said, is a few minutes per eye. We give you a Valium type medicine that relaxes you. The good news is you don't need IVs or needles or stitches. The procedure itself is comfortable. People really don't take pain medicines. before, during, or after the procedure. Um, they, you're awake, but you're in a calm, uh, you know, a calm twilight, type of consciousness. And um, people who, have the procedure done, they're like, boy, I was maybe a little worried, but I see there's nothing to worry about. It's very, very
Wow.
easy on me. Yeah. And then they go home. They're in our office maybe for 2.5 hours. When they go home, we have restrictions only of don't rub the eyes for a week, don't swim or hot tub for a week, and women no eye makeup for a week. And then the patients are using drops 4 times a day only, 4 times a day, not too rigidly, just breakfast, lunch, dinner, bedtime type of eye drop, 4 times a day for a month. So painless. And the next day, they're able to drive to the office. They can see without glasses.
I got a question here from Chad. Chad's asking us, what about people with keratoconus that also had LASIK? Great question, Chad.
Yeah, we have treatments for that. And our goal with one of our great specialties and one of my personal passions is getting people who've had keratoconus, getting them out of glasses. Sometime, and ultimately, the procedure that does that is refractive lens exchange. Now, sometimes they need cross-linking beforehand to strengthen the cornea and stabilize it to prevent a corneal transplant and keratoconus. So this is just keratoconus only. And sometimes then we do an INTAC or CTAC type of procedure, which some people probably haven't heard of CTAC, but it's a type of procedure to help people with keratoconus to see better with glasses. Then sometimes there's the topography guided aberration reduction surgery. And it's a laser procedure which is designed to give people with keratoconus or irregular corneas sharper vision with glasses so that they can get out of their um, rigid gas permeable lenses or out of their scleral lenses and simply to wear soft contact lenses or glasses. And if we can achieve that, if we can get someone into soft lenses or glasses who, someone who has keratoconus, then they are candidates for refractive lens exchange. Now, if you're someone who already does see well with glasses, even though you've had keratoconus, yes, you can get refractive lens exchange, and you only need that, last procedure. You don't need all these other ones along the way. Um, and we individualize that for you. The best thing is to come in for a consultation. We can determine if you need, need and desire. These are elective, but
Yeah.
one of those procedures or a number of those procedures. But
And
yeah, we
then
can get a lot of people out of glasses who have keratoconus, which is very gratifying. Yeah.
thank you for that question, Chad. Next question I would have is, what about astigmatism? First of all, what is it? And then is it treatable with refractive lens exchange, please?
Astigmatism is basically a cornea that's somewhat oval shaped. The cornea is itself a type of lens or optic, and if it's oval shaped, that cornea would then focus light as best as it could, but not to a sharp point, but more of a line or a double. A lot of doorways and straight lines can have an extra image. And so, yes, refractive lens exchange does correct astigmatism, can do that.
How about helping people to understand what their vision is going to be like after this procedure? What's their distance going to be like up close? Or how do we, and I know we have different lens options, but just sort of what's the expectation on vision post-procedure?
Yeah, most people having this procedure overwhelmingly are going to have good reading vision as well as good distance vision and good intermediate vision. Intermediate or mid vision means seeing someone clearly when you have a face-to-face conversation, seeing their computer, the dashboard of their car, food on the table, and that's mid vision. And then, good reading vision. People will be out of reading glasses. They're not going to be needing them. I mean, might put them on if you had a splinter in a child's finger, for example. I guess if you're reading, medication inserts on on a bottle of eye drops or something like that. But some people might need, reading glasses for that, and a lot of people wouldn't. So the vision after refractive lens exchange and is overwhelmingly gets people out of reading glasses and out of glasses altogether.
And then let's take the other side of it. Natural question people would have with respect to side effects. Is there anything short term, long term you counsel patients on with respect to side effects?
Yeah, there's some people can have mild halos at nighttime around car lights and street lights. There's lenses that give no halos at all. So that's where that customized decision comes up. Um, what type of lens to give. The lens that gives a very slight halo still is a lens that's used about 80% of the time because the halo is insignificant. I've put that lens in one of my best friends from high school. He was a college roommate, a physician, very competitive tennis player who really wanted to see far distance for tennis and then see two big computer screens at once without glasses, and then, of course, see his cell phone for text messages for near. And he got all that with the lens is called the Panoptix lens. The Panoptix lens is a multifocal lens. It is the best at giving true up close vision. It can give some halos at nighttime only around car lights and street lights, but then in October they've come up with the Panoptix Pro. The whole purpose was to diminish the halos and keep all the good things in. The Panoptix was already a dominant, the best lens available, and now the Panoptix Pro has made it even better to the point where the Federal Aviation Administration allows us to implant Panoptix Pro in pilots. They just have to take off 90 days to make sure that they don't have that they don't have halos that are bothersome. And we've even implanted Panoptix Pro in pilots. Some say I have no halos. Just go ahead and do my other eye. So it's been a really, really good lens. There's the other type of lens is called the extended depth of focus lens, EDOF. Extended depth of focus lens tends to give very good distance vision, very good intermediate vision, which I said is like face-to-face dashboard of your car and seeing a computer. But the true reading vision isn't as good with the extended depth of focus lenses. It's not as good as the Panoptix. But a lot of people really don't mind because they actually get good enough reading vision. And some of those patients we do extend an EDOF lens for distance and intermediate, and then the other eye for intermediate and near, and they get a significant overlap. They're not separate; they're significantly overlapped, and it's kind of a mini monovision type of look, and people love that. I think equally well. You know, one friend had put in a Panoptix. Now, and not even the Panoptix Pro. The Pro is even better. Another friend that put in an extended depth of focus lens. Interestingly enough, they're both flying in from San Diego for me to do this, and they both are equally happy. Different lenses, just we went through their preferences and customized that solution for them, and I think for a lot of people, they really can't go wrong with either one. Depends on the prescription. The ideal patient is 50 years of age or older who has blurry vision at distance and near. Those are the ideal and typical patients there. Some patients now who the Panoptix Pro has opened up more candidates for us. We have several people have done this morning who have very good distance vision, but they really don't like the reading vision. And
Mm.
so, we're breaking even on the distance vision, but improving the up close. And so that is what the Panoptix Pro has been able us to do. It's just opening the field more widely for more candidates.
Got a question here from Nathan. It says, I have astigmatism, but would like to have the best in all distances. Have you worked with accommodating lenses, and do you expect more options to be available soon?
Don't expect, I mean, there always could be more options available with accommodating lenses, but I have worked with them. They've been unsatisfactory because of the moving parts that are needed for them. So accommodating lenses basically um, uh, have a moving part that we try to get that lens to move in a certain way to obtain the near focus. But I mean, the Panoptix Pro lens is so widely used in it's so good at giving you the up close and the intermediate that it's gonna be a long time before I think before an accommodating lens comes out that can challenge that because the ones that have come out really haven't been satisfactory in my opinion. And I really stopped using accommodating lenses maybe 10 years ago.
Got it. I'm going to start the next one. Feel free to jump in, and it has to do with insurance. So, refractive lens exchange is an elective procedure. So, it's just something that you're doing for yourself. And we have amazing financing options, 2 year, 3 year, no interest you can take advantage of to make it palatable with your monthly budget. The range you're going to kind of find at our practice, $5,500 to $6,500 per eye. That's sort of the national average for the actual procedure, and you can kind of make it palatable with your monthly budget. FSA, HSA is usable as well. Dr. Cutarelli, did you want to chime in? I wasn't sure if you were saying something.
Yeah, FSA and HSA will cover refractive lens exchange. We have 2 year and 3 year no interest, no money down type of financing, so that makes it a lot easier for a lot of people. Um, and yeah, most people, find a way. This is something that they do for themselves, and they find a lot of value in it because they can see now, they can see quickly, they can see painlessly, they get distance and near. It turns back the clock effectively, and it's a permanent solution that prevents future cataract surgery. So that's and we've really pursued, special in our practice. We can perform the surgery in an office-based surgery center. So it's one simple bill, and people pay that. They don't get bills later in the mail. It's simply one, and they're financing it. They don't have three separate bills that they're waiting for that could, ruin their credit, on, $55 that's owed and things like that. It's very clear, and people know what's going on.
Let's shift to in our remaining time to talk about candidacy. So, I guess we could start out with where are we located, and then once you've done that, let's talk about what actually happens at the next step, which is the free exam for everybody. So, where are we located, and what's the next step, please?
Yeah, we offer free consultations in 4 locations. There's the Denver Tech Center, which basically we're at I-25 in Bellevue exit. We're actually on Union, which is a block north of Bellevue, right next to I-25 between South Syracuse and DTC Boulevard. And then in Fort Collins, we're on Horsetooth, on Timberline Road between Harmony and Horsetooth, so very near the I-25 and Harmony exit in the southern part of Fort Collins. Then Colorado Springs, we're at Woodman and Austin Bluffs, in northern Colorado Springs, and then we're in the Boulder Valley. We're actually in Broomfield proper, but that's by the very close to the Flatirons Mall. You do free consultations there, and we can determine if you're a candidate. The ideal candidates really are age 50 and older who have blurry vision, far away, and up close.
And then to round it out, let's talk about anything about that initial exam and I guess part of the answer is why should they choose our practice? So what sort of sets us apart, and what's that experience like in our clinic place?
I think we really have a strong emphasis on doing what's best for each patient, and we have the most experience in this area and the most technology. and all the techniques. So when you put that together, with the passion for getting it perfect for each patient, I think that's what really sets us apart. People feel like they're in a practice that really looks at all the best ways to get people out of glasses, not simply a narrow, we only specialize in LASIK. That's not the case here. I'm a cornea specialist. I do corneal transplants, cataract surgery, keratoconus treatment, and I've done the most LASIK and refractive lens exchange in Colorado. So we've really matched my training with our experience with the wide range of patients, the wide range of techniques and technology. So that's where people feel like they really get the best evaluation and the best treatment.
Yeah, and ladies and gentlemen, that will be the next step. We like to kind of have these around a half an hour. I know you're on your lunch break and whatnot. And the next step is to come on in for that free evaluation at our practice. You can do so by dialing the number that's on the screen. Go to cutarellivision.com. We'll give a sort of a last chance for anybody to ask any remaining question, please. If there's anything that's on your mind, you want to ask it right now before
Yeah.
we adjourn. And then we'll also, as a courtesy, have somebody from our team to follow up and give you a holler as well in case you have any questions. Um, Dr. Cutarelli, I want to give you unless there's any remaining question, any final words you'd like to say to everybody, please?
I really thank everyone for this opportunity to talk about refractive lens exchange. It's a procedure I've been doing for more than 15 years. And what's changed is that the techniques have been good for a long time. The technology has been good, but I think in the last 5 years, the technology has really gotten much better. And I think we need these webinars to get the word out. And I'm grateful to have the opportunity to be able to present it to you. So I look forward to seeing you in one of our offices. Thank
Great.
you.
Thank you, everybody. Have a wonderful day. And we'll take care of you when you come into practice. Take care.
Yes.
Bye-bye.
Thank you. Bye.